Hey, Dr. Josh here. In this video, I am going to go over cold laser therapy. Cold laser therapy is a tool that we use in this clinic either on its own or with other therapy services. It's very cool. The results are really sweet, and what it really does is it accelerates the healing process. So this is the tool that we use here. This is a portable handheld laser machine, and it's got 2 heads and 4 diodes, so the laser is emitted out of all 4 of these diodes at the same time. Typically we use it right on the skin. First and foremost is that laser therapy, laser light is emitted in the red spectrum, or at least this one is. It's emitted at 640 nanometers. So just a little background education on a laser so you know exactly what is going on is that within the red spectrum of light, you're moving anywhere from 400 or 500 nanometers into 900 nanometers. So when you get closer to 900 nanometers, you're getting into infrared light. And past that, you're getting into microwaves, and then all of a sudden, that type of light isn't visual anymore. So the red spectrum of light, and what we use here is right in the middle. It's at 640 nanometers. 600 to 800 is the most usable light for energy, which I'll talk about here in a second. But when you get into this, and it doesn't produce heat, and I don't use any therapeutic tools that produce heat on tissues of the body. It's just not a favorable situation for most tissues in the body. And when you're doing this, when you get into 900 and you get into 900 nanometers, this is gonna start producing heat for energy, which is not a favorable situation to be in to affect the tissues at the same magnitude. So we use this, it's at 640 nanometers. It's non-toxic, which means it doesn't produce any toxic effects to any of the tissues whatsoever. It's very, very safe to use on young people, on old people. We stay away from pregnancy and away from the eyes and some of the sensitive tissues, depending on what we're using this for. The other thing is that because it's non-toxic, it's safe. There's literally 0 contraindications to using this. And again, like I put here, it's non-thermal. It does not emit heat, which that's what makes it cold. It's not gonna be cold to the touch. It just does not emit heat. So what's the general mechanism of cold laser and why does it work so well? First thing is that the laser that's emitted is basically called photobiologic light. All right, there is a system in the body of photoacceptors that accept this light and uptake within the cell. So at 640 nanometers, when I use this on a specific tissue, it does not penetrate the skin like you think it would just penetrate into the skin. What it does, just like the sun, is the skin absorbs this light. And there's photoacceptor molecules that accept photobiologic light. What this does is it puts electrons in the cells at a higher state. And when you put electrons into a higher state, what you're doing is you're generating more meaningful ATP. And we know that ATP is the gasoline for the organs in the cells to run. So if you have a tool that's non-toxic and has been proven and shows and cleared to be able to produce more meaningful ATP, you're gonna increase protein and DNA synthesis. And if you do that, you have an upregulation of energy and you have an accelerated healing pattern. I don't care what tissue it is, that's exactly what it's doing. So photobiologic light hits the skin, moves through, photoacceptor cells and molecules pull the light. One molecule or one piece of photobiologic light can stimulate a large area. So like I said, when it hits here, it's not depth of penetration. It actually creates a ping pong ball effect when it hits the skin and moves through and absorbs into the body. Puts electrons into a higher state of energy, which in turn produces and generates more meaningful ATP, okay, the body's gasoline, the body's power, and with that, with more gasoline, with more power, we increase the synthesis of your own DNA and your own protein, which is the building blocks to tissues. So that's what cold laser does in a nutshell. So with that said, here's some of the situations and here's some of the protocols that we use. First and foremost, it's very good for modulating chronic or acute pain for that matter, being able to calm down pain cycles because it's actually generating a very accelerated healing process. The other thing that I really like this for is concussions and brain health and other brain-related situations. Concussions, which we'll cover in another video, is a mild traumatic brain injury. It sets off a neurodegenerative or a neuroinflammation cascade, which creates a lot of excitotoxins. It's not favorable to the body. What this does is it breaks that cycle. All right, there's tons and tons of literature, of peer-reviewed journal literature that actually supports the mechanism of what this does for increasing the healing potential for concussions and neurologic injuries. All right, and it's just the same thing. It's the same mechanism that happens in the brain. We're not trying to penetrate the brain with a laser. We're trying to get the brain to pull energy and to create ATP and calm down this neurologic smolder, so we can accelerate the brain injury process, the healing process, if you will, with concussions, brain health. Same thing goes with vertigo. Vertigo, being an equilibrium problem, comes from the eyes and the ears, so we're going to stimulate the energy of those centers and those nerves so it can calm down the effects of vertigo. It works extremely well for Meniere's disease and just basic vertigo there. So that's a lot of the brain and the central nervous system types of support that it does, as well as in the central nervous system and the peripheral nervous system. So brain to brainstem to spinal cord to nerves stimulates the production of nerve transmission. So we're looking for muscle weaknesses, we're looking for muscle degeneration patterns, atrophy, those type of things. We can help stimulate those processes to get the muscles to work more efficiently, or power them up, if you will there. Another big thing in how I got into this is tendinitis. So it works extremely well with tendinitises. Tendinitises are nasty because they linger. They don't have a very good healing potential, even as much nutrients and stimulation and manual therapies that you throw at it. I'm talking like tennis elbow, plantar fasciitis, patellar tendinitis, shoulder tendinitis, those type of things. So the laser gets in there and does a real good job of stimulating the energy activity within those tissues that don't have a very good blood supply. And the biggest thing that I see out of the gate is that the strength returns real quick with those, and then eventually over time the pain dissipates, because it takes a long time for these to heal on their own. So what this does is it just stimulates and accelerates the healing effect on tendons themselves. Joint health, so knees, shoulders, ankles, spinal joints. Spinal joints are very complex with nerves and the cartilage and tissue and ligaments and all that. So this does extremely well with just pointing and shooting into those joints to accelerate the healing potential of those tissues. And wounds and scars, that's another good one that we do for scars. So post ACL, post shoulder, are really using the laser to accelerate the healing of the scar. Even on old scars, so scars just non-functional tissue, and what it does is it just accelerates the tissue to start getting pliable and flexible, and it really does return it to its nice state, so you don't have this big keloided scar. So that's really some of the things that we use the laser for, but not limited to. Again, it's just an awesome tool that we use in practice almost every day. I have no idea how I would work without it at this point. If you've been a patient here and you've seen the effects of it, you definitely know. If you haven't, it's pretty cool, even for just general health and wellness and well-being. It's extremely good. We use it for hormone treatments and hormone therapy, as well as organic, so organs and heart, the lungs, the kidneys, liver, those type of things. So thanks for tuning in. We'll talk to you soon. Check out some of the other videos. We'll be doing an in-depth one with this and just a whole topic on concussions and brain health. I'll talk to you soon.